focused on actinomyces, each with 5 answer choices and detailed explanations, including the rationale for why the incorrect choices are wrong. Question 1. Oral facial presentation. A 34-year-old man presents with a slowly progressive, firm mass along his jaw. He had a dental extraction 3 weeks ago. Physical exam reveals multiple draining sinus tracts on the mandible exuding yellow granules. Gram stain of the drainage shows gram-positive filamentous rods. Which organism is most likely responsible? A. Nocardia asteroides. B. Actinomyces israelii. C. Staphylococcus aureus. D. Mycobacterium tuberculosis. E. Peptostreptococcus. Correct answer B. Actinomyces israelii. Explanation: Actinomyces israelii is part of the normal oral flora, anaerobic, not acid-fast, and classically forms oral facial abscesses with yellow sulfur granules, often following dental trauma. A. Nocardia is aerobic, weakly acid-fast, and more common in immunocompromised patients. C. S. aureus can cause abscesses but doesn't produce sulfur granules or filamentous rods. M. tuberculosis would cause pulmonary disease. It is acid-fast and doesn't present with facial abscesses. E. Peptostreptococcus is part of anaerobic flora but not associated with sulfur granules or sinus tracts. Question 2. Female reproductive infection. A 32-year-old woman presents with chronic pelvic pain and abnormal vaginal discharge. She has had an intrauterine device IUD in place for 5 years. Pelvic ultrasound reveals a complex adnexal mass. Endometrial biopsy reveals gram-positive branching filamentous bacteria. Which organism is most likely responsible? A. Actinomyces israelii. B. Gardnerella vaginalis. C. Nocardia asteroides. D. Trichomonas vaginalis. E. Neisseria gonorrhea. Correct answer: A. Actinomyces israelii. Actinomyces can colonize IUDs, leading to pelvic inflammatory disease (PID) with chronic symptoms. The branching filamentous morphology is classic. B. Gardnerella is a clue cell-forming coccobacillus, not filamentous. C. Nocardia is rare in reproductive tract infections and is weakly acid-fast. D. Trichomonas is a motile protozoan with flagella, not a gram-positive rod. Fash-E-N gonorrhoeae is a gram-negative diplococcus, usually causes acute PID. Question 3. Microbiologic features. Which of the following correctly describes Actinomyces species? A. Acid-fast, aerobic, catalase-positive filamentous rods. B. Anaerobic, non-acid-fast filamentous rods that produce sulfur granules. Facultative intracellular diploci that produce spores. D. Aerobic, urease-positive sulfur granule-producing rods. E. Anaerobic cocci associated with sinus tracts and granulomas. Correct answer: B. Anaerobic, non-acid-fast filamentous rods that produce sulfur granules. Explanation: Actinomyces are gram-positive, anaerobic, non-acid-fast, filamentous rods that form yellow sulfur granules, especially in oral or pelvic infections. A. Describes nocardia, not actinomyces. C. No actinomyces are diplococci or spore-forming. D. Actinomyces are anaerobic, not aerobic or urease positive. E. Anaerobic cocci are not filamentous or sulfur granule producing. Question 4. Treatment. A 41-year-old man with a history of poor dental hygiene presents with multiple draining jaw abscesses and yellowish granular discharge. Biopsy confirms Actinomyces israelii. What is the most appropriate treatment? A. Metronidazole. B. Trimethoprim sulfamethoxazole. C. Itraconazole. D. Penicillin. E. Clindamycin. Correct answer: penicillin. Explanation: Actinomyces infections are best treated with high-dose penicillin for prolonged durations due to their chronic fibrotic nature. A. Metronidazole is good for anaerobes but not first-line for actinomyces. B. TMP-SMX is used for nocardia, not actinomyces. C. Itraconazole is antifungal. E. Clindamycin can be used as an alternative if penicillin allergic, but it is not first-line. Would you like similar sets for